Welcome to Romania. First time in Bucharest?
My second time.
Second time in Bucharest. So you already know our Romanian patients. You already know their emotions. Thank you very much because your work here is for them it's free of charge.
I thank you for this opportunity. I saw some patients with endometriosis. That is a common disease in young women. So it's very important. This is also because the patients have pain in their menstrual period, severe pain, dysmenorrhea, dyspareunia. So their quality of life is not good. We do ultrasonography or we do sometimes MRI for detect some endometrial lesions, and if we saw some endometrial cyst in their ovaries by ultrasonography, first we offer some medications, and if we solve the problem with medications, they have no need to go for operation. But sometimes they need operations. We do this operation with laparoscopic surgery because laparoscopic surgery has many advantages over the open surgery, like less incision, less infection risk, shorter hospital stay, and fast recovery. And nowadays we do almost 100% laparoscopic surgery for endometriosis patients. We do this operation with small incisions, like 5 millimeter incisions, and the patients are happy with this because this is more cosmetic and less pain and less adhesion risk, because this is also very important for infertile patient. Because after open surgery we see some severe adhesions, and this causes infertility.
But as I heard, you are this already. You make laparoscopy with only one incision.
Yes.
How is this possible?
Yes, surgery is changing, and nowadays we can do our operations just with single port, with single incision, and we use umbilicus, and we do just 1 centimeter incision, and we do many operations with this technique. I did single port robotic hysterectomy also.
Can you explain? Can you explain?
Yes. We use umbilicus. We do 1 centimeter incision, 1 to 2 centimeter incision, and we use some special equipment, and we use robot, and we did hysterectomy first time in Turkey and also in the world, and we did live surgery, live transmission from Turkey to Washington. And this was the first operation in the world.
You like performances. In fact, in your CV, I can see a long list of this kind of performances. Yes. You are a very good speaker. That's why you are going in Far East, in Middle East, in USA. You are invited as a speaker. Yes. What are you telling to the professionals who come to listen to you?
I am organizing training programs, training courses, mini workshops for train the young gynecologists to teach them these techniques, because I believe that the future of surgery is laparoscopy and then single port surgery.
The body of your patient is like untouched. Yes. It's hard to see.
Yes, this is like the scarless surgery, because after the surgery there is just hidden scar inside umbilicus, so you can't see any scar. So woman wants scarless surgery. So we can do this.
After this kind of surgery, the patient is staying how long in the hospital?
Just one day.
If we compare the present with the past, there are so many women nowadays which complain that they cannot get pregnant for years, and they are doing everything possible. How do you explain this evolution, if I can say evolution?
Yeah. And they want baby maybe after 35 years old, and ovarian reserve is very important factor, and maybe the reason is decrease in ovarian reserve.
I saw in your CV that you started training of virtual reality in gynecologic laparoscopy in Turkey for the first time.
Yeah.
What means virtual reality in gynecologic laparoscopy?
Virtual reality, we are teaching laparoscopy to our student or to our resident or our young gynecologist with in OR, in operation room. But this is not useful, and this is high risk education. But if you use a computer system like pilot, you can train this assistant, this student without any risk.
For the patient?
Yeah, for the patient, without any risk for the patient. Yeah, you are right, because yes, because we have apprenticeship model for surgeons education.
You also did several live surgeries. Yes. In those training programs. Yeah. This means the students are following you live when you make a surgery.
From maybe other countries or other cities, they can watch my surgeries.
In the meantime, you explain, you make the surgery, yes, and in the same time you can talk?
Yes, I do surgery and explain at the same time, and they watch me, and I can show them some tricks and tips in this kind of surgery.
Do you listen also to them? They can put you questions and you can answer live during the surgery?
They can ask, and they ask me a question and I answer them during surgery.
Can you please choose one or two real challenges for your career?
Yeah, I had a patient came from Bulgaria, and she had infertile patient. And
how old she was?
Around she was 30 years old, and she applied for IVF, in vitro fertilization. I did examination, and I checked the patient, and I decided for hysteroscopy before IVF to check the endometrial cavity, if it's okay, it's useful for IVF or not. And she had any complaint. Menstruation is normal. And
no pain?
No pain, nothing.
Nothing to worry about.
Just diagnostic procedure, and I did hysteroscopy, and I take biopsy and sent pathology, and resulted in endometrial cancer.
Cancer?
Yes.
And she simply didn't have any sign of
No
it?
sign. No sign.
How important is a checkup,
Yes.
in fact?
So she shocked. I shocked also because this unexpected result.
30 years old.
30 years old, yes. So she asked me about yes, this is a cancer, but she want to keep the uterus, and we discussed patient this is not it's unusual situation.
So usually when you have to take out.
Yes, because normally we have to take out the uterus, and but she said I want
A child. Yeah.
yes. So we reviewed the literature and we decided to give a chance to her, and I gave a medication 3 months because this very early stage of cancer.
She was lucky in this.
Yes, she is very lucky. So after 3 months she came back and we took biopsy again, did hysteroscopy, and the result is normal.
So optimistic, yeah.
Yes, so we then gave again 3 months medication as a protocol of this therapy, and we are waiting the result. And if the result, endometrial biopsy, is normal, we go for IVF.
I think there are a lot of emotions in medicine, involved, because we are talking about a very sensitive area. Yeah. When we are talking about women, pregnancy, we are talking about life itself, So you have it sometimes simply in your hands. How do you feel in this position?
When I succeed, I'm very happy. I feel very happy because my patient is happy, and if I see my patients happy, I'm happy.
What are the new techniques used nowadays in Acibadem?
Yes.
Because every day we have to be well informed in order to know what to choose when we will have a problem. We will be very happy if we will not have health problems, but life is as it is.
Robotic surgery is a new area, and nowadays we are going to do more surgery with robots, because yes, robotic surgery like laparoscopic surgery and has advantage like laparoscopy, less incision, less infection risk, faster recovery, shorter hospital stay like this. But I believe that the future will be robotic surgery.
What made you take this decision to move after more than 20 years in Istanbul and to work in the Acibadem team?
Acibadem is a big hospital group, and they have many facilities and robots and new technologies. So I like technologies. I like new techniques.
In fact, you need to have the best tools.
Yes.
In your operation room, yeah?
Yes, if we have best technology, we can do better.